Did you know that nearly 1 in 5 people infected by COVID suffer from long COVID? Let's talk about it. Long COVID is defined by new, continuing, or recurring symptoms that occur 4 or more weeks after the initial coronavirus infection. Long COVID is associated with all ages and acute phase disease severities, with the highest percentage of diagnoses between the ages of 36 and 50 years of age. The majority of long COVID cases are in non-hospitalized patients with mild acute illness. Your hypothalamus is rich in ACE2 receptors, and it's hit hard by COVID. Since it controls your autonomic nervous system, which controls your heart rate, sex drive, memory, cognition, salt-water balance, thirst, hunger, gut function, and cellular metabolism, it's no wonder that the majority of the symptoms of long COVID are signs of hypothalamus dysfunction, including fatigue, brain fog, post-exertional malaise, heart palpitations, dizziness, thirst, issues with sex drive or capacity, gastrointestinal symptoms, pain, menstrual irregularities, sleep issues, depression, and anxiety. People with long COVID feel that doctors are not listening to them, and doctors feel frustrated that they don't have the resources and information that they need to deal with long COVID. Although there are no approved treatments for long COVID, people with long COVID experimenting with countless therapies on a trial and error basis. Among the most popular are low-dose naltrexone, anticoagulants, antivirals, beta blockers, statins, antihistamines to calm overactive mast cells, and probiotics to improve gut health. Doctors are trained to tackle a couple of issues per visit and to use evidence-based approaches and to use codes to get their health system reimbursed. But to make medicine systematic, doctors are trained in different specialties based on separate organ systems. Long COVID generally affects multiple areas of the body, so long COVID patients feel like they're on their own. Long COVID has been compared to chronic fatigue syndrome in that there appears to be an underlying metabolic issue. Like CFS, ongoing immune activation and inflammation severely affecting the hypothalamus function perpetuates the symptoms of long COVID. So where can you start to get relief? Supporting your hypothalamus with Genesis Gold helps optimize hypothalamic function. Genesis Gold has helped many of my patients with chronic fatigue syndrome and now is helping my long COVID patients. If you want to learn more, please join us in our hormone reboot training. I'll see you in the next video.